Mycobacterium tuberculosis. This sounds like a big, scary word. Tuberculosis is a scary infection that can have a deadly outcome in some cases. Signs and symptoms. The signs and symptoms of tuberculosis are dependent on where the bacteria is growing in the body. It typically grows in the lungs. That is called pulmonary tuberculosis. Signs and symptoms of pulmonary tuberculosis are a cough that lasts 3 weeks or more, pain in the chest, coughing up blood or phlegm, or sweating at night. People with latent tuberculosis infection do not show symptoms, don't feel sick, and cannot spread tuberculosis. What is tuberculosis? Tuberculosis is caused by a bacterium called Mycobacterium tuberculosis. There are 2 different types of tuberculosis, latent or active. People with active tuberculosis don't have an immune system to fight it off, causing symptoms to show. So you might be wondering, what exactly happens when you get infected by tuberculosis? The bacteria are inhaled in droplets. They enter into the lungs, and when the immune system defenses fail, the bacteria starts multiplying and spreads to other tissues and organs through the bloodstream and lymphatics. This causes you to become very sick. How is it spread? Tuberculosis is an airborne bacteria. This short clip will help explain how it is spread.
Also known as TB, is spread through the air from one person to another. When someone with pulmonary TB disease coughs, TB bacteria are expelled into the air in tiny water droplets. These droplets can remain floating in the air for several hours, making it possible for someone nearby to inhale them. Once a person has breathed in droplets that contain TB bacteria, they travel down the trachea and enter the lungs, where they collect in the alveolar sacs.
As you can see through the video, it explains a person-to-person transmission. This makes it easily transferable through coughs and sneezes. Tuberculosis treatment. Active tuberculosis can be cured in most cases. However, in some rare cases, the bacteria may be resistant to treatment. Medications are key when it comes to treating tuberculosis. For active tuberculosis, you take antibiotics for 6 to 9 months or longer. The exact length depends on a variety of factors. Even though medication is vital, the reliance of medicine in our world has led us to multi-drug resistant strains. This makes it extremely difficult to treat. Drug-resistant tuberculosis is a man-made problem by inappropriately prescribing tuberculosis meds. It can be slowed by education and proper treatment of disease and infections. Resistance happens because there is a lot of germs in the body. Then you take antibiotics to take away bad bacteria. However, antibiotics are unable to kill drug-resistant bacteria. Then these drug-resistant bacteria duplicate and take over. Where is it found? Tuberculosis is found in various places across the world, but it is more prevalent in some areas than others. Across the world, different countries have higher rates than others. This may be because of access to adequate healthcare and because of heavy population. As you can see, Africa has a significant amount of cases. This may be because of inadequate healthcare. In other places such as India, they have a large population in a small area. Tuberculosis is not limited to countries overseas. Many people across the United States are affected by tuberculosis. In the United States, it is typically due to dense populated areas. As you can see in this map, areas such as Los Angeles and Phoenix have many cases, and this might be due to their high population. Who is at risk? Even though anyone can get tuberculosis, there are some people that may be more at risk than others. These people include people with weakened immune systems, people who work in or live in crowded places such as nursing homes or prisons, people with poor access to health care, and people who are exposed to others with tuberculosis, such as traveling to countries with higher rates. COVID-19 and tuberculosis may sound very similar, but in fact they are very different. Both diseases infect the lungs in different ways. Tuberculosis is a bacteria, and COVID-19 is a virus. The treatment for COVID is the same whether or not a patient has tuberculosis. Essentially, poor treatment outcomes result from patients with both COVID-19 and tuberculosis.